Well, you may not hear as much about HIV these days, but it's still an epidemic. There are 43,500 new infections a year across the country. And instead of just managing the disease, now there's an effort to prevent it. Kelly Swoop joins us right now with more to explain.
Well, Jamie, this treatment is being called groundbreaking, a way to prevent HIV. And, you know, it's really important here in Baltimore because we're still among the top 20 cities in the country with a high HIV infection rate. Now health experts have a new tool in their arsenal.
Folks are being ravaged by this virus, and they don't have to be.
Anthony Morgan's views on HIV prevention are as clear as the view from his Mount Vernon apartment.
There's been so many eggs in the intervention basket and so many eggs in the, condom basket that, we've seen over and over. A lot of people are dropping that basket, and then there are no other options for them.
That's until now.
When we talk about risk reductions of 80+%, that's game-changing.
Nurse practitioner Jason Farley has been prescribing that game-changing medication for nearly 2 years now. Truvada is the medicine used in pre-exposure prophylaxis, pre-exposure prevention, or PrEP for short. When taken effectively, it prevents the spread of HIV. Johns Hopkins is among the 3 major clinics in Baltimore offering PrEP.
Patients in their teens up into their late 40s and 50s. We evaluate your sexual history and risk and then develop a comprehensive prevention approach. That includes testing for HIV every 3 months.
Truvada is an antiviral drug approved by the FDA and the CDC.
This is really a new, I think, and powerful prevention tool.
Dr. Chris Byrer, director of the Center for Public Health and Human Rights at Johns Hopkins, has spent the past 23 years working in HIV and AIDS research. He says PrEP is a major breakthrough.
PrEP is the first new biomedical prevention tool that has been shown to be able to reduce HIV infections really since the condom. Part of the PrEP program is counseling, is education, is regular testing. So if you are agreeing to get an HIV test every 3 months, you're taking it seriously. San Francisco is aggressively promoting PrEP as part of its campaign to end HIV.
Public health experts believe Baltimore's high number of HIV cases make the city a perfect environment for PrEP.
Young men who have sex with men, young gay and bisexual men, particularly young men of color, who are sexually active and who are not living with HIV are at very high risk of acquiring HIV. Those are folks we really want to get the information about PrEP out to.
You have all these HIV infections that totally could be averted if only people knew about this information.
Morgan has been on PrEP now for 6 months. He works as a research coordinator with gay and lesbian adolescents at Johns Hopkins School of Medicine.
It fit my sexual health script. Right, I want to be, attached to, or I want to be informed about every sort of new technological advancement that can keep me healthy.
And he wants others to know about it because he believes PrEP can save lives.
Growing up as a young black gay man, I've said there are a few things that I need to absolutely make sure don't happen to me, and one of them is becoming HIV positive, because it's preventable.
Now, Truvada is supposed to be taken daily and in conjunction use with a condom. When taken as prescribed, experts say it can reduce your risk of requiring the infection by about 99%, so that is major.
Yeah, when was this approved by the FDA? Why are we learning just now about it?
Well, it was actually approved in 2012, but it is being rolled out now in some of the major cities across the country, New York and San Francisco, just to name a few. But the people are asking their providers about it are usually people like Anthony Morgan, somebody who works in the health industry who's well informed. But the push now is for Baltimore to spread the word. They're trying to reach that 18 to 26 age group. Chase Brexton's going to hold a town hall event tonight to raise awareness about PrEP. Taking place at 1111 North Charles Street at Chase Brexton from 6:30 to 8 o'clock tonight. So,
that's good.
Spreading the word.
All right, thank you, Kelly. And here